My name is Vernon Lee Medicine Cloud, and my title is Diabetes Prevention Program Coordinator. The Diabetes Prevention Program is a 16-week-long course here at the Indian Health Center that provides education, nutrition, and exercise to American Indians who are at risk for prediabetes. And some of the things that are in the daily life of being a diabetes prevention program coordinator are contacting patients. Sometimes you have to do a one-on-one with them, talk to them, get them in. Go to events. I go to every single American Indian event there is to try and recruit folks who might possibly be at risk for prediabetes. Go on the radio show, television shows to talk about it. We have this diabetes prevention program at the Indian Health Center. A lot of community work has to be done. You have to build the trust. You have to build the relationship. Some of the risk factors for diabetes are being overweight, family history of diabetes in the family. I went to Silver Creek High School on the east side of San Jose, and a lot of people are affected on these diseases on the east side of San Jose. You know, fast food is on every single corner, almost on the east side. McDonald's, Jack in the Box, Carl's Jr., KFC, just everything. East side's kind of like the ghetto of all San Jose. You know, people kind of think like, well, it's the ghetto, it's the hood and stuff, and in some aspects it is, you know, but doesn't mean we're ignorant or don't have the education to go on and above and succeed. I got into this job because my mother had diabetes herself. She would monitor her blood sugars and things like that, but it just deteriorated really quickly, her life. You know, blindness came. We went to so many specialists. They tried to save her eyesight. Her leg had to be amputated, and that was really tough for me to see that. It broke me up inside, and it just, until you go through something like that, you don't know what the disease can cause. She passed away. She had a massive heart attack, and she was only 50 years old when she passed. That's really young. She got robbed. My educational career path currently is I'm attending San Jose State University, where I'm a junior. If somebody wanted to get into this type of field, they could start by volunteering at a local clinic, just to get some exposure to the types of diseases that are out there. It would be good if you had a degree, but you don't necessarily have to have a degree. I think just knowledge about diabetes is key to this job, and to have a heart and to care about it, to care about the people.
My name is Amy Yu, and I'm the Outreach Coordinator at the Asian Liver Center at Stanford University, which is the first nonprofit to address the high incidence of hepatitis B and liver cancer in Asian and Asian Americans. My mom actually has hepatitis B, so it really brought that home. I didn't know what hepatitis B was when I was growing up. My mom actually never let us eat the same food she did, because she also didn't understand how hepatitis B was transmitted. She thought it was through food, but it's actually only through blood. There's just lack of knowledge, and I wanted to be a person to bring that knowledge to people so that people don't have to worry about transmitting it to their kids or their loved ones. I work on our various projects that we have. They're large-scale projects, annual projects that we do, and I work on the logistics and the operations of that. And I also work with a group of 12 undergraduate interns, and they come into the office and I get to help them with their various projects. I also work a lot in the community. A lot of times I'm actually out of the office and I'm in the community working with various leaders and doing site visits for screenings and various outreach projects that we do. We have a youth leadership conference in August every year where high school students from across the nation, in fact, come, and they get to meet high-profile leaders in the communities, and they learn how to develop, execute, and evaluate outreach projects so they can bring those home to their own communities. Some of our high school students have been doing a great job with spreading the word about hepatitis B, because 1 in 10 Asians and Asian Americans have Hep B, and it leads to liver cancer. So here is a t-shirt from one of our high school groups at Gunn, and what they did was they created a Jade Ribbon group at their school, awareness group, to kind of highlight what they're doing. And this is the front, actually, Jade Ribbon Club, and they have a back. And it's really neat because they're trying to educate their peers. So this is a fantastic way and a really innovative way to do it. Hepatitis B affects Asians disproportionately because it's endemic in the population, and what that means, it just started there. What hepatitis B does is that around the age of 30 or 40, it develops into liver cancer. And if you find out you have liver cancer early, you can actually take out the tumor, you can remove it and before it spreads, so that way it's not deadly. So that's why it's so important that people know early on, because once it progresses to end-stage liver cancer, it's really hard to remove the tumors, or it's already spread throughout the body. Because it has no symptoms until it's too late, generation after generation gets it. It's transmitted through blood, and in Asians it's primarily mother to child, so most people don't even know they have it because they got it from their mom at birth. People don't like talking about it, don't want people to know they have Hep B, but we really count on, the youth of our generation to really make it something that's normal to talk about it, because the more people know about it, that it's more normal to talk about it, then people are actually saving lives. My job just requires a 4-year college degree, and you have to have the enthusiasm and really want to work in the community. Even people who have hepatitis B, they don't know how it's transmitted, and it caused a lot of pain in our family because my mom wasn't allowed to share our food with us. And so I wanted to let other people know how it's transmitted, what it's about, so they don't have to suffer and they can save the lives of their loved ones.
My name is Judith Ned. I'm originally from Baton Rouge, Louisiana. I'm the youngest of 6. My job here at Stanford involves my being the executive director for the Stanford Medical Youth Science Program. It's held on Stanford's campus, and we have about 476 young people who've gone through our program. We introduce students to science and medicine in a variety of ways. It's for low-income and underrepresented minority students. How did I get to this career? This was not a straight path. The college admissions and the college guidance information was strictly for those kids who were the AB students. That wasn't me. I was a C student. I went where I thought I could get in, which was a school probably about an hour away. That was easy for me to get to, but when I got there, it was the most difficult place for me to be. It was in a rural town. It was predominantly Caucasian. I was probably one of the few minority students there. It was just awful. I wanted to be a veterinarian. Applied to veterinary school, got in veterinary school. I flunked veterinary school, first semester. Flunked my histology class by half a point. That meant I had to take the entire year over. And I said, no way, kid, I'm not doing it. I got into what's known as AmeriCorps. AmeriCorps is the domesticated version of the Peace Corps. Worked in community development in a small town in rural Louisiana. But I learned a lot about community development. I learned a lot about leadership skills. It was stuff I had no clue about. I got my first position here with SMYSP, doing program coordination, working with about 13 schools in the San Joaquin Valley, introducing the schools to science and health careers. And I just finished my doctorate in '08, and I have a second master's in educational leadership and a doctorate in educational leadership. So that's the path. I wanted something better. I lived with an alcoholic father, very verbally abusive, but not physically abusive. And I saw that I wanted something different. I would not subject myself to living in a situation where I knew that I couldn't have those things that I saw other people with. So I pushed myself. And especially when people told me that I couldn't, especially those people like my counselors who didn't give me the chance because I was a C student, I had to prove you wrong. There's so many health issues that are circulating in our communities, heart disease, alcoholism, obesity. We need health professionals to address those, especially minority health professionals. The kids that I work with, those are my results. I see them now telling me what they're doing. I can see the fruits of my labor.
My name's Chris, and I kind of got interested in science mostly just because it was the most challenging thing presented, especially once I got to high school, and I always was looking for something challenging to do. In college, I majored in biology. I worked in a lab doing actual research all throughout college, and then decided I wanted to go to grad school, keep doing the research, and that's where I am now, doing immunology research.
My name is Ching. I'm from San Diego. My mother was once a doctor. She studied oncology, and then because it was very depressing to not be able to help patients, she transferred into a graduate program and started to try to do science and cure cancer. So that's sort of how I got into science. My mother would take me to the lab, so I feel like I grew up in the lab. It was an obvious path for me because it was always what I was around. And then when I was about 14, I developed a disease, autoimmune disease called psoriasis. And that's when I really got into immunology. And sort of that's what propelled my path towards learning about diseases, how they work, and then trying to figure out how we can create therapies for the diseases. We get to teach the kids about different techniques, and today we were showing them how the different properties of DNA can be used to identify criminals in a crime scene.
Every experiment we have here has some sort of focus around genetics. So there's always an overlying theme of what is DNA, how does it affect who you are and what you become, and then we do an experiment, be it taking DNA from cow meat out just to explain what DNA is, or today we were helping solve a murder mystery. Other things can be figuring out, well, why you might or might not like broccoli or Brussels sprouts. Is it because of your DNA? If you were in high school and looking, how would you actually start going about the path to become a scientist? There's a lot of ways you can go about doing it. When I was in high school, I actually started out by volunteering in an aquarium, a museum, just like the Tech Museum. I also volunteered in a lab to actually learn real lab skills, and that really helps set you up for then going on to college. But you can also start by, after high school, getting an associate's degree at a community college that can help you do something in criminology, just like the CSI murder mystery solving we were doing today here at the Tech Museum.
Volunteering is a great way to just get your foot in the door and to see if you're really interested in pursuing that pathway. I know people who graduated high school, got a job, then realized that, it was very mundane or boring, and then they went back to go to school, and then now they're, much older than us, but they're still pursuing their career in science. So it's really just a searching pathway, and you don't know unless you try.
I'm Gabriel Garcia. I'm a professor of medicine. I'm the Associate Dean of Medical School Admissions, and I'm the Peter E. Haas Director of the Haas Center for Public Service at Stanford University. In my work, a lot of what we do is give our undergraduates the tools, the skills, the attitudes, the knowledge, and the modeled behavior that they will need to be effective in community engagement. And learning from community, using community in some ways as the text to learn about real life problems in real life places. I'm Cuban born. My family emigrated to the United States in 1960. We spent 3 years in South Florida, which is where I learned English, and we eventually gathered as a family in Puerto Rico. I went to college knowing that I wanted to be a teacher, but not being sure what subject I would teach. I was assigned an advisor in the fine arts department. But one of the things she told me very clearly is that if I wanted a career in science, that I needed to meet other people at the university. And I was introduced to a neuroscientist at Stanford. And in the few meetings that we had together, it was clear they had devoted themselves to advancing the field of neurobiology. And that was a big part of my growing up as a professional, is understanding the fact that I too could engage in the process of discovery and have the same enjoyment that they clearly were having at their work. One of the important things about health professions is that they are very broad, and just because you enter a health profession does not necessarily mean that you will in fact be limited in what you will have in your future. Health professions generally expand the possibilities of things that you can do in your future.
My name is Kim Rhodes. I'm an assistant professor of surgery at Stanford. Well, I would say a typical day is atypical. It starts with a long drive. I actually live in Oakland. I use the time in the car, which is about an hour, to kind of transform from mom to doctor. And then I'll be in the operating room anywhere from 7:30 when it actually starts, finishing up somewhere around 2 in the afternoon. 2 days that are clinical are the main 2 days that I spend sort of focusing on patient care. The other 3 days of the week, I have the good fortune of being able to do research. I didn't want to be a surgeon as a child. In fact, at the end of high school, I had no intention of going to medical school. And in fact, in college, I had no intention of going to medical school either. I had a mentor in junior high. Her name was Alice Gross. And she told me when I was 14, she said, "You're going to Berkeley." And I said, "Okay, I'm going to Berkeley." And then once I got into Berkeley, I had a big decision, which was, am I going to do science or am I going to do something else? So I did linguistics because I was good at foreign languages and I was interested in how language shapes the way we interact with each other. But by the end of college, I started thinking, what am I going to do for a job in linguistics? I really had no idea. So I decided to take the coursework to maybe consider thinking about going to medical school. During those first few years of medical school, actually, my aunt was diagnosed with breast cancer, and it was pretty advanced. And so I made a few phone calls, and I got treated pretty poorly. She ended up dying while she was getting chemotherapy. And as I started reading about it, I found out that Black women get breast cancer less often than white women, but when they get it, they're more likely to die. And that just actually really made me so angry. One of my favorite sayings is, "Be the change you wish to see in the world." And it's a quote, I believe, from Gandhi. I do see myself as a change agent, and I feel like it's a mission of mine to see that there's justice in healthcare and to see that everyone who gets cancer gets high quality care and that their outcomes are the best they could possibly be. That, to me, that's the ultimate reward, is to have an opportunity to impact the process of how we provide care to certain populations.